good morning. Thank you for joining us for another Ministry of Health virtual media conference on the COVID-19 response. Our esteemed panelists today are the Honorable Terence Deyalsingh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and Dr. Gregory Boyce, Deputy Director of the Medical Research Foundation of Trinidad and Tobago, and Candice Alcantara, Manager of Corporate Communication for the Ministry of Health, and your moderator this morning. We go straight to the Chief Medical Officer for the clinical update.
Hi, good morning. Thank you, Ms. Alcantara. Good morning to the Honorable Minister. Good morning, Dr. Boyce, members of the media, members of the viewing and listening public. So I'll begin as usual with the update for the 5th of November 2021. Total persons tested so far at both public and private facilities, 404,365. Of those, in the last 24 hours, we had 140 new cases reported, taking our total since 12th of March to present to 58,581. Of those individuals, 51,643 are recovered, leaving total active cases of 5,185. Those in home isolation now stand at 4,687, with a total of 1,753 deaths. And condolences to the families of all of those who would have lost loved ones during the pandemic. Our hospital occupancy, total patients in hospital 337, those in step down 21, in state quarantine 80. The percentage of patients in the parallel healthcare system who are not fully vaccinated during the period July 22nd to October 20th, 93.1% of those persons were not fully vaccinated, 4,809 of 5,166. Just a little additional detail as it relates to the hospital occupancy. We have the Couva Hospital and Multi-Training Facility, 77 persons, 25 in ICU, 14 in HDU. Cora, 23 persons, Augustus Long, 39. St. Anne's Hospital, 14, Arima General Hospital, 50. New Point Fortin Hospital, 53. St. James Medical Complex, 51. Scarborough Regional Hospital at Fort, 26. And Scarborough Regional Hospital at Signal Hill, 4 persons. Thank you, Ms. Alcantara. Back to you.
Thank you very much, CMO. And now we go to the Honorable Terence Deyalsingh, Minister of Health, who will give us some more details on our vaccination figures this morning and an update on the vaccination protocol development. We go to the Minister of Health.
Thank you very much, Candice. Good morning to the Chief Medical Officer, Dr. Parashram. Good morning to our first-time guest, Dr. Boyce, this morning from Deputy Director from MRF-TT, who will be sharing some interesting perspectives about HIV, AIDS, and vaccinations. Good morning to ladies and gentlemen of the media and good citizens of Trinidad and Tobago, wherever you are, on whatever platform you are viewing and listening. Let us start with the first slide, please, as I give you the vaccine uptake update. So, as of close of play last night, 626,790 persons have accessed their first dose. Congratulations to them. And even bigger congratulations to the 614,158 persons who have completed their either 2-dose regime or their 1-dose J&J regime. Thank you very much for making yourselves available to be vaccinated. For this week, our average vaccination rate, Monday, Tuesday, Wednesday, Thursday being a holiday, and yesterday, roughly about 1,200 persons per day are accessing our free vaccinations, WHO vaccinations, at all our vaccination sites. I really want to congratulate and thank these 1,200 persons a day for making a very informed choice to be vaccinated. You are not only protecting yourself from acquiring the disease, but more importantly, you are protecting yourself from severe disease, and more importantly, from ending up in an ICU or an HDU and ultimately succumbing to the disease. So every day that 1,200 persons start this journey, it's a good thing. They are protecting not only themselves, but their families, their co-workers, their parents, and so on. Next slide, please. This basically shows you in graphical format what is happening. The figures are the same. 614,158 fully vaccinated. 626,790 on their way to being fully vaccinated. I would like to spend now a few minutes talking about a very positive development in our battle against COVID-19. This very positive development is Trinidad and Tobago's and the Ministry of Health's position all along to continue to bring best international practice based on global evidence as collated by WHO on everything dealing with COVID-19, whether it's contact tracing, whether it's therapeutics using dexamethasone, whether it's using the interleukin-6 inhibitors, whether it's only bringing WHO-approved vaccines. Today, Trinidad and Tobago, again, is making a very large, huge, but responsible step based on WHO evidence as part of our global monitoring of the COVID-19 scene. And this very positive development has to do with the administration of additional primary doses. As the slide shows, Trinidad and Tobago is now in a position to offer to certain selected groups of persons, which we will get into, of what we are calling, based on WHO's interim guidelines, an additional primary dose of the COVID-19 vaccine. Notice the naming, the nomenclature. We want to encourage persons not to refer to it as a booster. The CMO will go into the technical difference between a booster and an additional primary dose. What we are launching today is the additional primary dose of a COVID-19 vaccine. Next slide, please. This forms part of an extended primary series of doses. It is targeted to certain categories of individuals who have already been vaccinated. So that is point number one. It is available to those who have already been vaccinated. If you are not already vaccinated, start that journey now. Start that journey, whether it's a 2-dose vaccine, Sinopharm or Pfizer, or the J&J one shot and done. Start that journey. But what we are focusing on this morning are those subpopulations who have already been vaccinated and who can now access the extended primary series. Next slide, please. It is broken up into 2 categories of vaccines, the Sinopharm vaccine and the other vaccines. We will deal with the Sinopharm vaccine first. I will just give you the policy position, and then the CMO will go into technical details. The Sinopharm additional primary vaccine will be available to 2 categories of persons. Category 1 is those persons 60 years and over who have already received the full complement of the Sinopharm vaccine, regardless of your disease state. So you could be a 60-year-old healthy person with no diabetes, no comorbidities, not immunocompromised. Under these guidelines, you are eligible for your 3rd dose. Correct, CMO? Mm-hmm. Lovely. And there we have some seniors. The 3rd dose to be administered up to 6 months after your 2nd dose or as soon as humanly possible. Next slide, please. Interim recommendation number 2 for Sinopharm again. Regardless of age, If you are moderately to severely immunocompromised, and the CMO will go into what that means, you can also access your third primary shot of Sinopharm vaccines as per WHO protocol. So let's just recap. Let's just go back. Let's not deal with that slide yet. For Sinopharm, it's a two-pronged approach. Anybody over 60, regardless of your health status, can access it. And then anybody, regardless of age, but who are moderately to severely immunocompromised. What are the categories of persons we are looking at now? Let's go forward. People in 5 main states of ill health. Those with active cancers, transplant recipients, those who are immunodeficient, those with HIV, and that is why we have Dr. Boyce this morning, and those on immunosuppressive therapy. The CMO will go into the technical details of that. So if you fall into any one of these 5 categories, as determined by your physician with a referral letter, active cancer, transplant, the main transplant we do in Trinidad and Tobago is kidney transplant. However, if you had another organ transplant abroad and you are here, just give us evidence and you could access it. If you are immunodeficient for some reason, for example, you're on dialysis or for some other reason, those living with HIV, and those who are on immunosuppressive therapy, for example, our lupus patients and so on, you can access your third shot. Next slide, please. Right. Everything that we have said about the 5 immunodeficient states now apply to the AstraZeneca vaccine, Sinopharm, as we just explained, Pfizer, and Johnson & Johnson. There is no age limit for AstraZeneca, Pfizer, and Johnson & Johnson. We will be administering, in the case of AstraZeneca, your third additional primary dose. In the case of Pfizer, your third additional primary dose for persons 12 years and older, because as you know, Pfizer is the only one approved for persons 12 years and older. The others are for persons 18 years and over. And if you did the one-shot Johnson & Johnson for persons 18 years and over. Next slide, please. The standard practice as outlined by WHO in the interim guidelines is as far as humanly possible, and the CMO will go into the possible one exception. It is like for like. So if you got Sinopharm, you take Sinopharm as your additional primary dose. If you are the recipient of a Pfizer vaccine for those 12 and over, you will be eligible, if you are moderately to severely immunocompromised, for your third Pfizer shot. If you are a Johnson & Johnson recipient over 18, you will get your second additional primary shot for Johnson & Johnson. Next slide, please. Most of the patients are going to be in the public healthcare system. So we have factored that in. If you are a private physician or a private patient in any of these conditions, you will be required to bring into us a referral letter from your attending physician to determine your suitability to receive the extra primary dose, the extra additional primary dose. Certain groups will be given additional primary doses at specific sites, so they don't have to bring in a letter because we know them. For example, the people who are kidney transplant recipients, we know we have about 100 in our public health system. They will be dealt with. They don't have to bring letters. Um, Most of the patients with HIV/AIDS are in the public system, so they don't have to bring letters. However, if you're a patient in the private sector, you will need to bring in a referral letter, and both Dr. Boyce and Dr. Parastram will go into the technical details as to how we will treat with HIV patients. Patients with lupus, if you're in the public system, you will be dealt with. However, if you're a private patient, again, you bring in your referral letter. Same thing will go to our cancer patients. All our cancer patients in the public system, you don't have to seek out the vaccine. We know you, we know the clinics, St. James, San Fernando, Eric Williams, Sangre Grande, Cancer Society. The vaccines will be brought to you. And that is how we will deal with the major amounts of the persons who qualify for these additional primary shots. Same thing to do with dialysis patients. Most of you are in the public system. The vaccines will be brought to you where you receive your dialysis once you qualify as moderately to severely immunocompromised. So the basic message is, today is a very exciting day, a very positive day in our battle against COVID-19. Trinidad and Tobago will be starting next week. Just a message to the over 60s, which we will have a lot, who received Sinopharm. You will be called by the RHAs to make an appointment to come in to receive your third dose. So don't appear at the sites from Monday. You will be called. We have the database of your names, your numbers, your ages. So we're going to make it convenient for you. We don't want you waiting there a long time. So you will be called. All this will be published later on today. So those Sinopharm recipients over 60, regardless of your disease state, you will be called to come in to receive your third dose regardless of your health status. The others will be dealt with in the public health clinics, and if you're a private patient of any of those health status, disease states we are speaking about, you will need to bring in a referral letter from your attending physician. So, Candice, I want to thank you for the opportunity to bring this positive development to the population, and back over to you.
Thank you very much, Minister Dayal Singh. And we actually go back now to the Chief Medical Officer to provide some more information on the additional primary dose of the COVID-19 vaccine.
Yeah, so thanks, Candice. But there's only one bit that needs clarification. I think on one of the slides there was a bit of, on the left-hand side, you couldn't see the time frame for giving the third dose of Sinopharm. So just for clarity, that Sinopharm for persons over 60 years of age is any period between 3 and 6 months after your second dose. And of course, the shortest time thereafter, if you go beyond 6 months, you can have that third dose. The other point of clarity that Minister alluded to, in the first instance, we had said that it will be like for like. For example, if you have Sinopharm, you get another dose of Sinopharm as your third. AstraZeneca can be given a third dose of Pfizer in the event that we have a shortage or there is a short supply of that particular vaccine. But we'll be starting initially with AstraZeneca first, second, and third dose, and then there will be some room, as it is a WHO approved combination as well, AstraZeneca followed by Pfizer a little later on, if we need to do so. So that's the only clarification I saw from Minister's presentation.
Thank you very much, CMO. And the Minister just highlighted that certain categories of HIV positive persons will need an additional primary dose of a COVID-19 vaccine. And we have with us Dr. Boyce, who will give us some more detailed information on this matter.
Hello and good morning, Ms. Alcantara. Thank you for the gracious invitation. Thank you Good morning to the Honorable Minister of Health, to the Chief Medical Officer, and to members of the media and to listening public again, good morning. So again, I am Dr. Gregory Boyce, Deputy Director of the Medical Research Foundation, and I want to, on behalf of the Medical Research Foundation, thank the Honorable Minister for the invitation to have a conversation about issues relating to HIV, COVID-19, and to the importance of immunization and vaccination among persons living with HIV. So I'd just like to you put up the slides, please. So what I want to do today is to build the case for the importance of vaccination against COVID-19 in persons living with HIV. I'm going to consider three questions in order. One, are persons living with HIV more susceptible to COVID-19 infection? Second, are persons living with HIV more likely to develop severe manifestations of COVID-19? And the third and final question would be, are COVID-19 vaccines safe and effective in persons living with HIV? So when we talk about susceptibility to infection, remember we have to think about not just the strength or weakness of the person's immune system, but we also have to think about those factors that place persons living with HIV at greater risk of coming in contact with COVID-19. And that would be different host factors, socioeconomic issues, for example, are they living in overcrowded housing? Do they have jobs such that they're exposed? The environmental factors, whether indoor or outdoor, and other contact patterns that may impinge on risk of coming in contact with persons with COVID-19. Now, there's a term that came up there called CD4 count, and I just want to explain it briefly. The CD4 count is the way we measure the strength of someone's immune system in a person living with HIV. The higher the CD4 count, the stronger the immune system. The lower the CD4 count, the weaker the immune system. Now, a lot of the initial studies that looked at this question of susceptibility to COVID-19 among persons living with HIV, the studies were small, the results were a bit inconsistent. So we weren't able to get good clarity as to what the actual susceptibility was. But there has been a recent paper that was actually a combination of different studies that did in fact show potential increased risk of getting COVID-19 among persons living with HIV around about 24%. And the theory around which that paper was based was that based on the population under study, that they saw that a lot of persons who were presenting sicker were presenting to hospital at higher rates, suggesting that the lower the CD4 count, meaning the weaker the immune system, the higher was the susceptibility to infection. So if we proceed to the next slide. So in answer to the first question, are persons living with HIV more susceptible to COVID-19 infection? There's a possible yes there. There's always need for more data, but I think the more we study this phenomenon, the more we see that there's a greater potential risk. So second question, are persons living with HIV at greater risk of severe manifestations of COVID-19? So a lot of the early studies were small. They weren't able to properly address what we call confounding variables, meaning persons with HIV have other issues that, just as the regular population, they have hypertension, they have diabetes, overweight, smoking, and those things impact on risk of a severe outcome because it's a comorbidity in addition to HIV. But as time went on and we were able to gather more and more data, we were able to get a clearer picture, at least a clearer consensus that seemed to suggest that there was an increased risk of a severe outcome among persons with HIV who contracted COVID-19. Next slide, please. So this is one such study. This is from the WHO clinical platform for COVID-19. It's a large database with 37 countries submitting data regarding persons with COVID-19. And of all the persons in this database, about 15,522 were living with HIV. From over, as I said, 37 countries, over 90% were on antiretroviral therapy. But in this cohort, more than 94%, almost 95%, as a matter of fact, were from South Africa. And what those two charts to the right of the screen actually show is that HIV infection, after you adjust for all the other things, whether it's age, other comorbidities, there was a significantly increased risk of greater disease severity and higher mortality, meaning persons with HIV were 13% more likely to wind up in hospital, and there were almost 30% higher chance of severe outcome or mortality purely related to the HIV status. Next slide, please. And this is the second paper I wanted to highlight. And this was studies that were based in centers in the United States and a couple in Europe, primarily Spain. And it included 286 adult cases of confirmed COVID-19 among persons living with HIV between the period 1st of April to 1st of July of last year. And what the bottom line is that if you see under that the line that says CD4 count, persons with a CD4 count, meaning an immune system strength less than 200, which is advanced immunosuppression when it comes to HIV, were more than 5 times more likely to be hospitalized because of the severity of the COVID-19 disease, as compared to someone living with HIV with a CD4 count above 500, which is a normal range of CD4 count, with a normal immune system. And such was the impact of having that weakened immune system that it was approximately similar to the increased risk of hospitalization from someone who had chronic kidney disease, which is one of the long-time factors that we know contributes to severity of COVID-19 disease. Next slide. So, second question, are persons living with HIV more likely to develop severe COVID-19? I think the answer is a big yes. And in addition, persons living with HIV who are the most immunocompromised, meaning CD4 is less than 200, are the most at risk of developing severe manifestations and dying from COVID-19. And final question, are the vaccines safe? Next slide. So, one of the things that hampered our ability to answer this question properly, at least initially, was that the early studies did not initially include a lot of persons living with HIV. But after some advocacy and pressure from different groups, they began to include persons living with HIV who were well controlled, who had what we call suppressed viral loads. The viral load in HIV is how much HIV virus is there in one drop of your blood, essentially. And what we're aiming to on treatment is to get the viral loads down to such a low level that is considered what we call undetectable, meaning that the machine we use to check how much virus is in your blood can barely find enough to count anymore, right? Now, when these vaccine studies were done, there was no suggestion that COVID-19 vaccines were either less safe or less effective in persons living with HIV as opposed to persons who are HIV negative. Next slide. And that caused the UNAIDS, not the UNAIDS, sorry, UNAIDS, to come with a fairly clear statement that's available on their website with respect to COVID-19 vaccines in persons living with HIV. It emphasizes that vaccines used for COVID-19 across the board are safe for persons living with HIV, are expected to be as effective, but we'll come to the little caveat with that shortly, as effective in persons living with HIV as opposed to persons who are HIV negative. And they kept emphasizing what we've been talking about all along, that even though someone is vaccinated, you should still maintain the 3 W's: wash your hands, wear a mask, watch your distance, right? And again, continue taking antiretroviral therapy. Why? On antiretroviral therapy, you keep your level of virus in your blood down, you keep your immune system at a nice strong level, and those things combined reduce the chances that if you were to come in contact with COVID-19, that would have a bad outcome. Next slide. So just to emphasize, subsequent to the initial studies, there were several different studies among persons living with HIV to actually document what were the responses like in terms of the immune system responses to vaccination. What they found is that in persons living with HIV with good CD4 counts, suppressed viral loads on treatment, had essentially the same immune responses to COVID-19 vaccination compared to HIV negative persons. And in addition, there was no detectable difference in adverse effects between persons with HIV and persons who were HIV negative. But there was also evidence to show that in persons with low CD4 counts, so for example, as the protocol shows, less than 200, or detectable viral loads, meaning persons who either are unaware of their status, persons who are aware of their status but not on treatment, who are not well adherent to treatment, and allowing the viral load to go up, that there were poor vaccine responses. And that supports the recommendation for an additional dose. Next slide. So essentially, are vaccines safe in persons living with HIV? The answer is yes. Next slide. Next. Right, so in summary, persons living with HIV are carrying a disproportionate burden of COVID-19. Remaining in care and on treatment is even more important now than ever. And vaccination remains the single best approach to reduce the risk of severe COVID-19 among persons living with HIV. So just to emphasize that point, if you're living with HIV and unvaccinated, come in to get your vaccine. We've been giving the vaccine to our clients at MRF. If you prefer not to come to our site, there are multiple other sites you can get access to. If you are fully vaccinated and you fall into the groups that the CMO and the minister would have spoken about, especially those with CD4 count less than 200, come in to get your additional primary dose. And just a final note to what respect to vaccination in prisons, the prison medical system under the Ministry of National Security will make special arrangements to get those persons who are living with HIV in the prison system vaccinated. And thank you very much. I'll turn back over to Ms. Alcantara.
Thank you very much, Dr. Boyce, for providing such clarity on what could have been a complex topic. Thank you very much. We go into the question and answer segment at this time. Media representatives, this is your opportunity to pose questions to our panelists. Please pose no more than 2 questions at the same time. Be as brief as possible. And if we have time, we will come back to you. Just indicate your name and the media house that you represent. We begin with AZP News this morning.
Good morning, Priya Bihari, azpnews.com. My first question is for Minister Diyal Singh. Minister, I know the ministry has been a stickler for following WHO guidelines, and I don't think that the WHO has approved booster shots yet. Can you say why the ministry is now going outside of these policies? What is the thinking behind that? And therefore, would we be seeing, that very soon we would also give the vaccines to children who are 5 years and over? And my second question is for the CMO. CMO, what has the contact tracing shown in terms of the surge in cases? Is there any specific event that has caused that? Thank you very much.
Thank you, Priya, for allowing me another opportunity to repeat what I said at the start. At the start, I clearly said these are interim recommendations for extended primary doses, and I urge all of us not to use the word booster. So we are not going outside of WHO. That's why, if you go back to the slides, please, because I don't want people to get the wrong impression. If you could go back to the slides, where we said these are additional primary doses. And I said clearly, let's not use the word booster. And I said clearly that the CMO will explain the difference between a booster and an extended primary dose. And that is what we said. It is an extended primary series, an additional primary dose of a vaccine. So I hope that answers your question. Priya, thanks for raising it to allow me the opportunity to re-clarify. CMO.
Yeah, as Minister said, it's not considered a booster in the language of WHO. A booster, and it is under consideration during the month of November by WHO. They are considering booster doses for all types of vaccines. A couple of weeks ago, there would have been a presentation to all World Health Organization member states related to the data surrounding booster, the efficiencies, the effectiveness, the safety. WHO is now considering that on their own through their SAGE group, and hopefully by the end of November they will make some decisions or make a statement as it relates to booster doses. So booster doses differ from the primary series, an additional primary dose, in one main way. Generally speaking, boosters are given, for example, a person may have 2 doses of AstraZeneca. After a period of time, maybe a year, maybe 18 months, you would begin to see a decrease in the antibody response in terms of a waning immunity. A booster is given at that point to increase or bring it back to the level that it was before. A primary shot is slightly different. So for the group of persons that Dr. Boyce would have gone into some detail with regards to HIV, those individuals have an immunocompromised system. So they don't respond in the same way to another individual who's not immunocompromised when you receive your primary series. So for someone who is otherwise well, under 60, receiving 2 Sinopharm, for example, they won't be needing an additional dose to reach to the immunity threshold that you want to reach. However, for somebody in Dr. Boyce's category, or a cancer patient, for example, who has immunosuppressive therapy, they will require an additional dose, which we are calling an additional primary dose, to bring that level of immunity up a little higher, and it is considered as a primary dose, not as a booster. So it is a difference in time when you give it, and of course it is related to your immune response in certain subtypes. I hope that clarifies the issue. The second question related to the upsurge in cases. As you have noted, there has been a plateau, roughly about 200 for many months. We started to see about 2 weeks ago thereabouts a gradual increase in the rolling average over the last few weeks. It is multifactorial. We are looking at Delta. When we saw Delta introduced into the country, generally what you see is that as the prevalence of Delta increases, you tend to expect that the threshold or the disease threshold in the country will increase. We have been seeing increased numbers of Delta cases being confirmed, and we are now at a stage where Delta is considered to be wildly prevalent in the country. Now, reminding everyone that Delta, as it compares to the P1 strain even, is 2 to 3 times more transmissible. So it is possibly the Delta element being the most significant part of the change that we are seeing, bearing in mind that other activities would have been changing as we went. There was opening of different sectors during the month of October, so it is multifactorial. You can't say it is one factor, but it's not a cluster-based scenario where it's one cluster of diseases contributing to this sort of change.
Thank you very much, CMO. Let's go now to TV6, please.
Hi, good morning to the panel. Alicia Boucher from TV6 here. I just wanted a bit more information on two particular groups in relation to the third primary dose. What happens in terms of HIV patients whose viral loads are almost undetectable and their immune systems aren't as weak? Do they still need that third primary dose? And also in terms of pregnant women who may fall into any of the other categories,
sure,
outside of the age 60, of course, but into any of the other categories, what happens with their third primary dose? Do they still take it? And we heard that the Lady Ho Choi home is under quarantine, sure, with at least 25 persons being infected with COVID-19. Yeah. Can you say whether the ministry has had any word of this, and if yes, whether there's any state intervention there?
Sure. So let me answer the Lady Ho Choi home first, and then we can deal with the other ones. So in terms of the Lady Ho Choi, I have gotten notice from my CMOH for St. George West. The number of residents in that home, 68, 38 females, 30 males. Number of positive cases so far, 14 residents and 9 staff. Severity of cases, there has been no hospitalization. There are only 2 individuals with mild fever this time. The rest of the persons, I am told, are asymptomatic. Number of persons vaccinated in the home, 47, 26 females, 21 males, giving us a total vaccination rate in that home of 70%, just under 70%, 69%, which is a very good indication, although the persons would have been positive. And the reason we found out that they were positive, not that they had symptoms, is because in settings like that, there's transmission of communicable disease very easily from one person to the next. So we would have tested the entire home, and that's how we picked up the asymptomatic positives in that particular group. And again, the high vaccination rates would have helped so far to prevent any hospitalizations and to decrease the symptomatology in that particular group. As it relates to the question on pregnancy will be treated just like any other vaccine if you're considered immunocompromised. Of course, Pfizer is approved for that particular group. You can have a third primary dose of Pfizer in the pregnancy particular group. Dr. Boyce, I think, wanted to go into a little more detail with your question as it relates to HIV. Dr. Boyce?
Hi, good morning, and thanks for the question. So just by way of clarification, there are persons, once they're on antiretroviral therapy, usually by 6 months after starting treatment, their viral loads will go down to undetectable levels. But remember, the protocol advises persons with CD4s less than 200. So the majority of persons who start treatment will start treatment with CD4 counts well north of 200, right? 300, 400, sometimes 500. So that even though they get down to undetectable levels, the CD4s are already higher than the point at which they need that additional primary dose. Right? Now, in terms of persons who are on treatment, and this would be a very small number, who might be on antiretroviral therapy, having already achieved an undetectable viral load, and the CD4s are still less than 200, they would need to come in for the additional primary dose. And that's a conversation they can have with their caregivers, either us at the Medical Research Foundation or the other treatment sites.
Thank you very much, Dr. Boyce. We go to TTT.
Good morning, Terry and Brown Campbell from TTT News. I only have one question. I'd like to get some figures regarding children who have, as school has reopened more than a month now, if we're having any spike among children, Form 4s to Form 6 who are attending school. Thank you.
Sure. Yeah, so basically, as you know, the Ministry of Education is responsible for the primary response. They actually have nurses as well as a physician assigned to them. So they are doing the collation of that data. However, my CMOHs provide technical oversight. And they have reported, as you saw in the papers, there was a report of Irie High School, I think last week. So there has been reports of cases occurring, but the primary agency to collate that data and report is the Ministry of Education.
Thank you, CMO. And now on to Newsday, please.
Hi, good morning. My name is Rhea Chetram. I just have two questions, please. I'd like to get an update on what's happening at the Irie High School, a status update on the contact tracing. Were there any more cases? Because when it happened, 60 individuals were identified. And two, will the ministry be looking at reopening team sports or reconsidering allowing Ascension football tournament to continue? Because recently it was denied, but the league has said it is willing to follow all requirements and implement all strict regulations for players, coaches, support staff, and even spectators. So just wanted to know if team sports will be considered to be reopening soon.
Thank you for the question pertaining to team sports, whether the ministry makes that decision. From the start of the pandemic, measures to be implemented and measures to be rolled back have always been the domain and the prerogative of the Honorable Prime Minister. Based on consultation with the Ministry of Health, myself, the Chief Medical Officer, Dr. Hines, who will give him the epidemiological response and report on the data, based on the hospital capacity that Dr. Mariam Abdul Richards always gives, and what Dr. Trotman is seeing clinically. The ministry does not make those decisions. So, for the example of team sports, beaches, safe zones, alcohol, full service, it is always the prerogative of the Honorable Prime Minister who makes the decisions to either implement or roll back measures. So all those decisions, whether it's sports, casinos, places of worship, everything else will be made by the Honorable Prime Minister and announced in due course. What we are trying to do as we open up more and more is to just keep people as safe as possible. Let us get our vaccination rates up. The more people who are vaccinated, the more things that can open up. We are down now to 1,200 per day, which is not a good place to be. We are now crawling in our vaccination drive when we should be leaping and bounding. We have another 200,000 to 300,000 persons over the age of 12 now who are vaccinatable, but who are not accessing vaccines in large enough numbers. So I hope that answers your question. Over to the Chief Medical Officer.
Yeah, so although I have oversight information as it relates to the particular school, I prefer that question be pointed to my counterpart, the Chief Education Officer, so she can give the details as it relates to the individual schools.
Thank you very much, CMO. We have an additional question from AZP News at this time.
Good morning, Priya Bihari again, AZP News. There is evidence to suggest that a third dose of different vaccine gives you a greater level of protection. Is the ministry aware of this? And I know the CMO said that we only going to use a mix if you have a shortage of one. But why don't we consider the mix now when the evidence suggests that a third dose of a different vaccine has a greater effectiveness? Thank you.
Okay, so one, the data as it relates to that statement is being looked at, as I said, from SAGE. So there's data presented that was presented about 2 weeks ago that suggests that a vector vaccine, meaning something like AstraZeneca, for example, followed by Pfizer, gives you a slightly increased efficacy as it relates to like and like. But that data, as I said, is being looked at in detail to make a determination as it relates to boosters. WHO has approved AstraZeneca followed by Pfizer, AstraZeneca followed by Moderna. So in this instance, for the primary additional primary doses, we will consider AstraZeneca followed by Pfizer in that instance where the AstraZeneca stock is not adequate. Having said that, we have to consider the persons who would have had a single dose of Pfizer, and we need to have enough of a second dose of Pfizer to give those individuals. So if we use those Pfizer doses, for example, to give the second dose of AstraZeneca, you'll end up in a situation where you can't necessarily guarantee a second dose of Pfizer to someone who had a first dose. So we have to be careful with when you make the decision that you have enough stock of Pfizer to back up the first dose as well.
Thank you very much, CMO. And you mentioned the SAGE group. Can you just remind us who the SAGE entity is?
Sure. So this is an advisory group. Sorry. It's an advisory group that advises WHO. So it's a lead advisory group. They take the data from all over the world. For example, Israel would have presented data. They would have taken data from the UK, from US in their studies, and they make a recommendation to the World Health Organization. So it's a group of technical experts for this particular purpose, to look at the vaccines related to COVID-19, and they have been brought together from WHO, selected from countries all over the world as well.
Thank you very much, CMO. We go to TV6 for an additional question, please.
Hi, yes. Alicia Boucher from TV6 again. I don't know who would want to take this question. I know that the Prime Minister is the one who decides on the rolling back of restrictions and so on, but the Ministry of Health advises or consults with the Prime Minister. I wanted to find out, does the situation in ICU, where ICU is either near full capacity or full capacity, have any bearing on those consultations that may cause a rolling back in restrictions based on your consultations with the Prime Minister?
Yeah, so thanks. So as we have said on these platforms whenever we ask, we don't only look at any one data set. We look at the whole series of data that paints a picture to us. So if we think about it as a jigsaw puzzle, we don't look at one piece of the jigsaw to make a decision. So we will look at ICU capacity, yes. We will look at the rolling 7-day average, yes. We will look at vaccination rates, yes. We will look at the overall capacity of the parallel healthcare system. Is it 34%? Is it 50%? Are we approaching the threshold of 75%? We look at the number of variants we are getting. And each one of those is part of the puzzle. You put them together and we get a picture. So the short answer is yes, but we don't look at ICU in isolation. We don't look at positivity rate in isolation. We don't look at the rolling 7-day average in isolation. We put all of these factors together and see where does this picture, what does it paint? Does it paint an impending problem 2 to 3 weeks down the road? Does it paint a picture that we could be more relaxed? And that's how the decisions are made. So thank you for asking the question. But one point that I have been asked to reiterate is that many people are saying, and I'm getting this feedback, that those persons now who are vaccinated are starting to drop their guard with the public health measures as far as washing hands and wearing masks and social distancing. As we have seen in the outbreak in the home, which home is it again? Lady Ho Choi home. The promise of vaccinations is not that it is a silver bullet to cure you of everything. What it will do, and the promise which is being borne out in Lady Ho Choi, is that even if you contract it, you don't get severe disease. You don't go into hospitals. So the promise of vaccination is that it will save your life, most likely, prevent you from going into ICU and so on. But you still, as an individual or a cluster of individuals in your home, still need to practice the 3 W's. Washing your hands, wearing your mask, and social distancing, washing your distance. Okay? Thank you very much for the question.
Thank you, Minister. I see that we have AZP News with another question.
Yes, good morning. Minister, you didn't answer my question about what is status now with children 5 years and over. And I also want to ask what about frontline healthcare workers in terms of this primary dose? Thank you.
Could you just repeat your question about healthcare workers and primary dose? The CMO will take your question on 5 years and over. Yeah, what is the question?
Are we going to consider now that the frontline healthcare workers also get the primary dose now?
Okay, so
I can take both of them. Okay.
Yeah, so if I could start with your healthcare worker question. Once your healthcare worker falls into the category as we defined before, they will be considered for having their additional primary dose, meaning they have an immunocompromised state or they fall into that over 60 category, haven't taken Sinopharm. So those are the people that will be eligible. It is not based on exposure. It is based on your inability through your immune system to mount that kind of response that we expect. Your second question related to children 5 and over. So the FDA would have, as well as CDC, would have approved the use of Pfizer in that particular age group only a few days ago. So they began using it in the US. As it relates to Sinopharm, it is approved for 5 and up as well in Argentina, 3 and up actually, in Argentina, China, and the United Arab Emirates. Sinopharm has a paper before WHO for approval as well, which we are waiting to see what WHO will do in the coming weeks. But that is where we at with the 3 and up as it relates to vaccination. WHO has not approved any category as yet.
Thank you very much. I think our last question this morning thus far comes from Newsday.
Hi again, good morning. I'd just like to get an update on how the safe zones are operating in terms of how you all are monitoring it. Are you all seeing an overcrowding in these areas? And because we have an increase in cases, are they linked in any way? And if there are overcrowding, how is the ministry going to monitor and regulate what's happening there?
Thank you for the question. So the issue of monitoring of the safe zones is the remit of the Trinidad and Tobago Police Service. They have the power to enforce the regulations. So it's basically a law enforcement issue. I have seen reported in the news that 3 establishments to date have been charged for breaches of the safe zone policy. But monitoring and implementation of the safe zone measures is basically that of law enforcement as managed by the TTPS. Thank you very much.
Thank you very much. Okay, a final brief question from AZP News, please.
Yes, morning again, Minister. I just want to find out, can you give us an update on the number of vaccines we still have, the brands and the expiry?
Thank you. Thank you. So we brought into the country 1,795,000 doses of vaccines. To date, we have administered 1,240,948. So it means we have a balance of 521,428. As far as expiry dates are concerned, let's take it one by one. AstraZeneca, as you know, traditionally came with short expiry dates. And that is why we had to transfer some of these doses to other countries, as other countries have done. So the last batch of AstraZeneca is expiring at the end of November. We have reserved those doses for people with their second shots. And knowing that we will have this additional primary shot, we have ring-fenced about 5,000 AstraZeneca doses to persons in that moderately to highly immunocompromised groups. As the CMO said, if by the end of November, somebody who received their first 2 shots of AstraZeneca need their third primary shot, we then switch them over to Pfizer. As far as other vaccines are concerned, Sinopharm vaccines expire in 2023. The Pfizer vaccines, they have been granted an extended lifespan, shelf life of 3 months. Originally, they were going on November, which is this month. We now have them to use up until February of next year. So those are the expiry dates. Johnson & Johnson always came with a very long expiry date of 2023. So both Sinopharm and Johnson & Johnson 2023. Pfizer, that the current stock is February 2022, and the remaining AstraZeneca stock November 2021. Okay, thank you, Prior.
Thank you very much, Minister. And actually, we go right back to you for your closing statement this morning.
Oh, thank you very much. So I just want to reiterate that the WHO interim recommendations, which we have here, these are interim recommendations, meaning they can change. The interim recommendations as it regards to your extended primary shots. So if you received 2 shots and you fall into the moderately to severely immunocompromised, you can get your 3rd shot. In the case of Sinopharm, let me reiterate, it is slightly bifurcated. For Sinopharm, it is anybody 60 and over, regardless of your health status, and the RHAs will call you. You don't have to come to us, we will call you. For the persons in our clinics, and the public health care sector takes care of most of the patients, we estimate that across transplant, cancers, dialysis, HIV/AIDS, lupus, immunosuppressive therapy, we estimate the total population there to be about 20,000. But not all 20,000 are vaccinated, so you take that group off. And then it is the remaining percentage who are vaccinated who will be considered by their physicians to be moderately to severely immunocompromised, who can access the interim recommendations of extended primary doses. Let me just give you some numbers. We estimate the kidney transplant population to be about 150 over the years, but it doesn't mean all 150 were vaccinated. Cancers, we estimate to be between 3,000 to 5,000 in Trinidad and Tobago, but not all have been vaccinated. Dialysis is about 2,000, but again, not all are vaccinated. HIV/AIDS makes up the bulk of it. We estimate about 10,000. But then again, you have to now discount how many of those have been vaccinated, and as Dr. Boyce said, how many of those have a CD4 count of 200 and less to qualify for the extra dose. Lupus, we estimate between 100 to 300, and those on immunosuppressive therapy, both in the public and private sector, about 2,000. So that's how we build up our population, theoretically, of 20,000. But then again, as I said, you have to discount how many of those have been vaccinated, completed their vaccine regime, and how many of those will qualify under the rubric of moderately to severely immunocompromised. So I just want to close by saying this morning that we are in a good position to treat with these very special groups of persons who are already vaccinated, and you will be contacted, especially those 60 and over, in the Sinopharm group. You will be contacted by the RHAs and given appointments to come into us. The others, like cancers, we will treat you in your clinic setting. If you're a private patient, you come into us with a referral letter. Same thing with HIV/AIDS. We treat you in your clinic setting, but if you're a private patient, come in with your referral letter. Same thing with lupus. Same thing with your immunosuppressive therapy states. So I thank you, Candice, for the opportunity to repeat. And I just want to thank everybody again. I want to thank healthcare workers. I was in Cuba on Diwali Day. I was at the Oncology Center at San Fernando General Hospital yesterday. Again, doing fantastic work. Thanks to all healthcare workers, and thanks to all of those persons who are coming forward to be vaccinated. The numbers are not good, but I am still thankful for those persons. You are true heroes. You are true patriots, and I thank you.
Thank you very much, Minister, and for all our participants in the conference this morning. We have come to the end. We spoke quite a bit about those who need to get an additional primary dose of the COVID-19 vaccine. Just a reminder, still follow the 3 W's, everyone, please. Watch your distance, wear your mask, and wash your hands. And those of you who have not gotten the COVID-19 vaccine yet, just a reminder, we have facilities open this weekend. It's in the print media, on social media. The paddock is open today until 3, open tomorrow until 12 noon. In the East Costat, El Dorado, Wallerfield International Raceway, and the Larry Gomes Stadium, open until 3 today and until 3 tomorrow. In Central, UTT Chaguanas campus, open until 3 today, and SAPA is open until 3 today and until noon tomorrow. And those of you who need your second dose of AZ, Paddock, UTT Chaguanas campus, and SAPA can provide that for you. Everyone take care, and please remember to do your part to vaccinate TNT.
This is TTT. Live for local.
Good evening, I'm DK Ronsta. Welcome back to the TTT News. 12 secondary schools and 3 universities